So maybe let's start with brain health and go a little bit deeper on what you were talking about with respect to brain-derived neurotropic factor and what this is doing. So when we're building up lactate as a result of vigorous exercise, it's passing through the blood-brain barrier. It's going into our brains, and it's doing all sorts of beneficial things, like something called neurogenesis, right? So talk a little bit more in depth about the importance of lactate or the relationship between it and the healthy brain that we all are trying to, kind of foster.
Feel better, but I also know that I'm delaying the aging of my brain and helping prevent neurodegenerative disorders. So lactate, it depends on there's a lot of factors at play in terms of how much lactate you're going to make, right? So how intense you're going in terms of your exercise, your mitochondrial function, a lot of individual variability here at play. But generally speaking, when you start to go into that vigorous intensity zone, you can start typically. Our steady state lactate levels are less than 1 millimolar. And when you start to go into, 80, 85%, 90% max heart rate, you can get anywhere between 7 to 14 millimolar of lactate in your bloodstream. And this can be measured, you can go out and get tests. I've measured it before for myself. The lactate levels don't last long in your blood system. And that is because it is being transported and going and taken up by other tissues. So really, as far as I've measured repeatedly, it's about 25 minutes, and then it goes back to your baseline. So there have been a variety of studies that have shown, by the way, Dr. George Brooks from UC Berkeley was the first to really propose at the time this lactate shuttle theory, as he called it. And it's not really a theory anymore. It's been proven time and time again. But he was really the first to propose that lactate was being transported into circulation. It was being taken up by a variety of other tissues, notably the brain, and that it was, having beneficial effects in these other organs. So in the brain, so there is a transporter. Lactate goes through this, it's called an MCT transporter, and it gets into the brain. And there's been a variety of human studies showing that actually during physical activity, lactate is fueling the brain because, your brain is working hard. Your heart is working hard during exercise. Your lungs are working hard. Your brain is also working hard, right? I mean, this as an endurance athlete, your brain is also working hard during exercise. And lactate's fueling that, fueling the brain activity. That's been shown.